Suzanne. Can I help?
Oh, hi there. I got your card and I wanted to get some needles from you.
Yes, we can do that. Where would you like to meet?
Could you meet me at, just in a parking lot?
Okay, is there a number we can call when we get there, or do you want to just make an arrangement?
No, my cell phone's almost dead, so could we just take a time and we could meet?
So let's say in about 15 minutes?
Okay, I'll meet you in the parking lot in 15 minutes.
Okay, we're a white van. We don't have any, there's no name or any identifier on it. And there'll be a woman driving and a man beside me as the other person in the van, okay? And
Okay, so I'll just write you down when I see you?
I'm Suzanne.
Okay, thank you.
Bye-bye.
Bye.
I'm Linda Blake Evans, and I'm the Program Manager with Public Health Services of the VAN Needle Exchange and Street Health Program. Like any other large city, we're over at least 500,000 population. We have people with addictions. Addictions are a hidden problem in our city and affects many families. Our video hopes to educate the public about harm reduction, our program, and needle exchange, and that it can be an effective method in reducing the risk of infections in our community, helping people get the help that they require, and while keeping our community safe from disposed needles and reducing healthcare costs from people who may acquire infections from sharing needles. In this video, you will see actual clients of ours who have agreed to be part of our video, who will share their experiences and opinions of the needle exchange program, including one client who now is a volunteer with our program and in the community to give back to the community after going through his own drug rehab.
Hi, we're the van.
Oh, hi there. I called you. Can I get in?
Yes, you can. Come on in.
Hi there.
Hi, I'm Suzanne, and this is our volunteer who's working with me tonight,
Okay.
Joe.
Okay.
What can we help you with?
So I heard you guys have needles. So
Yeah, yeah. Do you have any dirties to give back to us?
Yeah, I do.
Okay. Just put them in the sharps container there. What is it that you need? Do you need some needles?
Yeah, I need needles.
Okay.
What do you guys have?
Well, we have sterile water, we have ties, ascorbic acid. That's particularly if you need it to cut your crack with. Spoons, filters.
Okay, can I take everything?
Yes, you can. As much as you need. I'll just put it in a bag. Okay. How many needles do you need? Sure. Okay. Do you need condoms?
Yeah, I need condoms.
Okay, both regular and flavors?
Yeah.
Okay. And some ties?
Can I get 2 ties?
Yes, of course you can. You can have as much as you want. There should be some there. Somewhere.
These nuts?
Yep. I don't know if you need all those, or do you want to just take a few with the...
Maybe I'll just take a couple.
Yeah?
Okay.
Yeah. Is there anything else we can help you with?
Well, what else do you guys have? Like, I don't really know what you do.
Well, we have lots of different things, information here. If you wanted to look at, you need some things.
I'm thinking about that I want to quit using, and I want to get my kids back, and I want to get my life back together, but I don't know what to do. I don't know.
There's a lot of different supports in the community that we can help you connect with. We do also have health care. We can do anonymous HIV testing.
Alright, so what are these for?
Those are sharps containers that you can put your dirty needles in, and we have stickers that have the van on it, so we can put on there as identifier. We can get you one. You can take one with you tonight, but if you're unable to get home,
I don't really want to take one tonight because I'm out. Like I'm
yeah,
home, right?
yeah. But you,
I could call you another time, like next week?
Monday to Friday, 8 p.m. to midnight.
Okay.
If you're comfortable leaving a phone number, we can return the call when we're out.
Okay.
If not, call us when we are out.
Okay. Well, I think that's everything.
Do you need any socks or mitts?
Yeah, I'm really cold actually.
Yeah.
Because I'm out tonight. So yeah, if you had anything on, that'd be great.
Yeah, we can give you some mitts. And they're back there. Can you just, sorry, you can go grab over there. Do you see them?
Grab them?
Yeah.
Okay.
You see one?
Okay.
Yeah.
Take a pair of these?
Yep.
Okay.
And,
Alright.
I think that's it.
Well, I think that's everything I need.
Okay.
Okay. Thank you.
Listen, you take care.
Alright. Okay, and I'll call you guys again.
Okay, bye-bye.
The Van Needle Exchange program started in 1992 in Hamilton after recommendation from a local task force interested in reducing the risk of HIV in our community. The van is funded through public health services and staffed by public health nurses, as well as a combination of outreach workers and volunteers. Our outreach workers are from a variety of agencies in the city, such as the AIDS Network, Aboriginal Healthcare Centre, and Elizabeth Fry Society. Our volunteers are trained and recruited by our local AIDS organization, and that's a very effective partnership.
So one of the reasons we decided to make this video is because there are some negative perceptions about people who use needles, harm reduction, and our role in helping people who inject drugs. Harm reduction focuses on the most immediate and achievable changes that can reduce the threat to the health and well-being of individuals. We have respect for human dignity, we're totally non-judgmental, and our services are confidential.
It's great, it's confidential, it's quiet, it's discreet, there's no stickers or anything on the van. And I think it's the safest thing going, instead of people using dirty needles and getting infected and diseased, and it's the best thing.
The goals of the Van Needle Exchange program are threefold. The first one is that we reduce the risk of infection from bloodborne diseases such as hepatitis and HIV through decreasing the use of shared needles. We also help keep used needles off the street as much as possible, even going to pick up needles identified in the community that are left behind by people. Our van gives out sharps containers and also certainly encourages people to bring back their used needles to our sites. Thirdly, we often are the first step for clients to connect with a healthcare worker, and we help link people to resources and services they need for immediate and future health care. There's also strong evidence locally that money is well spent on a needle exchange program. In fact, a study done in Hamilton demonstrated that every dollar spent on needle exchange program resulted in a $4 cost savings in healthcare costs, and that's due to preventing HIV and hepatitis, which, as we know, can lead to increased healthcare costs from people needing to use emergency rooms and hospital beds. We have documented that we have made over 10,000 client contacts per year doing needle exchange, and that's largely due to the cooperation that we have from some partner agencies who also distribute harm reduction supplies for us. And that's community agencies such as Wesley Urban Ministries, Aboriginal Health Centre, Hamilton Urban Core Community Health Centre, Marchese Healthcare, Elizabeth Fry Society, and Hamilton AIDS Network. And this is above and beyond what our van and street health center can distribute. So thank you again to our community partners who help make our program a success.
A regular night is at 8 o'clock. I either meet the volunteer here or I go and I pick them up. And we would pick up the messages on the phone that people had left during the day. And the volunteer would call them and arrange to meet them wherever that person wanted us to meet them. So either in front of their house, around the corner, at a convenience store, just whatever is best for them. So often people will need syringes, but now we have the whole works, and so if people need ties or water or cookers, ascorbic acid, filters, just whatever they need. And then often people, depending on what's going on, they might want to talk for a bit. If they're going through a crisis, they might just need some counseling. So we would go and do that the whole night until 12 o'clock, and as long as people are calling, we will keep on answering their calls and meeting them. There is a very great risk if people share needles in spreading HIV, hepatitis C, or B, because all of those are blood-borne infections, which means that they are transmitted through blood. So what they were finding is that if you share, there is, when a needle is taken out of the arm, there would be blood in the needle, on the needle, in the barrel of the needle, and so if the next person uses that, then they are shooting that blood directly into their bloodstream, which is a great risk of transmitting those diseases.
Without clean needles, I would probably have HIV by now.
If there were not a needle exchange program, I believe people would share needles and our rates of HIV and hepatitis B and C would go up.
I was actually too ashamed to go to the pharmacy to buy new needles, so I ended up reusing any needles I had. I would use needles from people that were around, try to convince other people to go to the drugstore for me. I think I used for 6 months or a year before I actually ever went to a pharmacy myself. Without clean needles, we ended up reusing them to the point where they'd become dull. Very hard to hit with a dull needle. We end up sharpening them on matchbooks. The Strikers is a very good sharpening tool.
People be getting sick. They'd be dying. They'd be using dirty needles all over the place. Sure they would. They'd be sharing needles, and that's not a cool thing. I use a needle once and throw it out. I have no scars or nothing on my arms to prove it. No holes, no traces, no tracks, because you guys supply enough that you don't have to use a needle twice to get sick, cotton fever, or anything like that. You use it once, throw it away.
You don't have to go out on the street looking for syringes, cleaning supplies, disposal containers. They're all provided.
Well, we were tending to rewash and reuse same needle over and over again, and not being nearly as hygienic about it and as safe.
I'd have to try and clean old ones. It gets scary with my situation.
I think if the VAN program didn't exist, there would be a lot of people using dirty needles. People wouldn't be able to access resources and counseling, and there'd be a lot more needles disposed of in very unsafe ways. A lot of people would keep a needle and use it over and over, which means that it would be getting quite dull, not as sharp, and have huge risk for contamination and infection. And large groups of people would be just passing one needle around between them.
I would watch people share needles all the time. My brother was a big IV user. He was a speed freak, so he used to share needles. If they didn't have any clean water or anything, they'd use dirty water on the ground, and no sharps containers, so they wouldn't break the sharp part of the needle. They just throw their needle on the laneway or on the street in parks, wherever they had to.
Yeah, they were sharing them and stuff, so I think that's really stupid. But then again, I've got the advantage of always having this here, so.
We help keep used needles off the street and out of public areas by providing a way for injection drug users to dispose of their needles safely, as well as picking up needles found in the community.
Another part of harm reduction is about reducing the harm to the community as well. And so what we do is we go out into the community and to places where people use and pick up any needles that are left behind there. So I try to go to different parts of the community about once a week and make sure that it's all picked up and clean and safe.
Whenever we hear of needles being found in parks or near schools or in playgrounds or on trails like this, we'll come by and search for them and find them and pick them up with the proper utensil, and then we'll dispose of them. We don't get too many calls like that, but when we do, we always make sure that we come out. And I'm on the van from 8 to midnight, so if it's not too busy doing needle exchange, I'll come and look for the needles and pick them up and dispose of them in a proper sharps container.
Our clients are very diverse. We are all over the city, from East End, Stony Creek, to West End, Ancaster, to up on the mountain, to North End. It's really no limit where we will go in the city.
We develop relationships with injection drug users and help them connect to the services they need.
Who cares? The people here are discreet. They're here to help.
They were there and they were offering me things that I needed that I wasn't willing to reach out and ask for myself, because addicts have a hard time trusting people, and when they're used to certain people. And the thing about the van is they have different shifts with different people, but you get to know all the people that go on the van.
It has a real sense of trust amongst its clients and the people that it serves. People feel safe talking to anyone on the van, and I've heard some incredible stories from people I don't even know, just because they feel so safe in approaching and sharing what's going on in their lives. It's also referred people to the different detox and addictions facilities, to the STARS program, to Street Health for HIV testing or for other types of health-related matters, to the Wesley, to the soup van. I mean, really any program that people who are living a marginalized existence need, the van has been able to help them access it.
Like if we refer somebody to McMaster, we'll make sure we give a bus ticket.
They also introduced me to the alcohol, drug, and gambling drug counselor they have here at the Street Health Center. And I hooked up with her and talked to her continually, probably for about 4 years. I do owe society, and this is my way of giving back.
I think that one of the things I love about being a worker on the van is that you get to be really responsive to what people need and what's going on in that situation.
Because they see us all the time, they know what we need.
The program definitely works. Without the van giving out new needles, I would definitely have HIV today.
In reducing the risk of infections in our community, helping people get the help that they require, and while keeping our community safe from disposed needles, and reducing healthcare costs from people who may acquire infections from sharing needles. In this video, you will see actual clients of ours who have agreed to be part of our video, who will share their experiences and opinions of the needle exchange program. Including one client who I'm Linda Blake Evans, and I'm the Program Manager with Public Health Services of the VAN Needle Exchange and Street Health Program. Like any other large city, we're over at least 500,000 population. We have people with addictions. Addictions are a hidden problem in our city and affects many families. Our video hopes to educate the public about harm reduction, our program, and needle exchange, and that it can be an effective method.
Hello, the van. Can I help?
Oh, hi there. I got your card and I wanted to get some needles from you.
Yes, we can do that. Where would you like to meet?
Could you meet me at, just in a parking lot?
Okay, is there a number we can call when we get there, or do you want to just make an arrangement?
No, my cell phone's almost dead, so could we just pick a time when we could meet?
So let's say in about 15 minutes?
Okay, I'll meet you in the parking lot in 15 minutes.
Okay, we're a white van. We don't have any, there's no name or any identifier on it. And there'll be a woman driving and a man beside me as the other person in the van, okay? And
okay, so I'll just write you down when I see you?
I'm Suzanne.
Okay, thank you.
Bye-bye.